come in.
Hello, how are you?
Good, how are you?
Good. My name is Mary Adelson. I'm going to be your nurse. What is your name?
Bernadette Fisher.
Bernadette, can you verify your date of birth for me?
9/28/82.
Very good. And what brings you here today?
Just for a checkup.
Okay, general checkup?
Yeah.
Very good. Okay, today I guess we're going to concentrate on cardiovascular system and the peripheral system. I'm just going to ask you a few questions before we start just to get a history, okay?
Okay.
All right. Bernadette, do you have any chest pain or tightness?
No.
Any shortness of breath?
No.
Do you use more than one pillow to sleep?
No.
Do you have a cough?
No.
Do you seem to tire easily?
No.
No. Does your facial skin ever turn blue or get ashen?
No.
No. Any swelling of the feet or legs?
No.
Do you awaken at night to urinate?
No.
Any past history of heart disease?
No.
How about in your family?
No.
No. Any leg pain or cramps?
No.
Any skin changes in your arms or legs?
No.
Have you noticed any sores or lesions?
No.
Any swelling in the legs?
No.
What about glands? Any swollen glands?
No.
What medications are you taking?
I'm not on anything.
Oh, very good. All right. Right now, that completes the health history portion. I'm going to start the physical portion of the physical exam. I'm going to be touching you, and we're going to make changes in your position here and there, and that's okay with you. I'll ask you to sit up and lay down. If you feel any discomfort or are feeling tired, let me know and we can stop, okay?
Okay.
All right. Right now I'm going to ask you to please lie back for me. I'm going to start my assessment with the carotid arteries. Just going to be inspecting at this moment. Take a look at them to see if there are any inconsistencies. And if you don't mind, please turn your face over towards that side for me. And I'm looking and inspecting. At 30 degrees, which you are in right now, I can see pulsations noted. And I'm going to ask you to turn towards me. Pulsations noted there, and there are about a 2+. I'm going to put this pillow behind your head just to elicit a 45-degree angle. Okay. And turn your head to the front. And at 45 degrees, they are slightly noted there. Move your hair here out of the way. Okay, very good. Pulsations noted at 45 degrees. And if I had a suspicion of any insufficiency, I would have elicited the 90-degree angle, but since I do see that you're a normal, healthy young woman, I don't see, I will not elicit the 90-degree angle pulsations. I am going to check for the external and the internal jugular vein, and I'm going to ask you again to look towards the I am palpating, and the external jugular vein is located actually in midline with the sternocleidomastoid muscle. And I didn't say it, but the grade of the carotid arteries were 2+, and on the right and the left, so they're bilaterally the same, which is normal. Okay. The external jugular veins are collapsed at the supine position and at 30 degrees. With the bed elevated at 45, the internal jugular veins are not visible, which is normal also. All right. And at this time, I'm going to be checking the precordium, and that's over the sternum. The skin generally is in line with ethnicity. Background is consistent. Skin is evenly distributed. Chest wall pulsations are not noted. I don't notice any heaves or lifts. I'm going to be checking for the fourth apical impulse, apical impulse, which is found at the fourth interspaced midclavicular line. And at this time, I am palpating first. And I can feel the apical impulse, which is a short, gentle tap, 1 by 2 centimeters. And if I would please ask you to turn over to your left side. Apical pulse again, I will find mid-clavicular line, fourth inner space. And the apical impulse, short, distinct tap, 1 by 2 centimeters. Okay, can you please turn that to my side? Right, I'm going to be listening to your heart sounds, and the heart sounds I will be listening to are the aortic, to listen to the valves when they open and close. The S1 and the S2 is what I'm listening for at this point. And at the aortic on your right side, I can hear the S1, S2, very distinct. I'm listening to the pulmonic directly across from the aortic. S1 and S2 heard. And I will be going below that, mid-sternal, lower border. Tricuspid is the area that I'm listening to at this point. And the mid-clavicular line, generally nipple line. That's the mitral. S1 and S2 are heard there. And S1 is louder than S2 at the apex, and it's in a distinct sound also. And that's heard during systolic. And S2 is louder than S1 at the base, and that's heard during the diastolic. Okay. And I don't notice or hear any murmurs. I don't hear any diastolic or systolic murmurs, and there are no extra heart sounds, S3 and S4. That's normal. You normally would not hear that. Okay? So that part concludes our cardiovascular system. I do want to tell you to try to keep a balanced diet in the 4 food groups. Avoid smoking and alcohol, okay? Now I'm going to move over to the peripheral vascular system. I'm going to be checking your skin. I'll be looking at your hands and your legs, and we'll take it from there, okay? At this time, I'm looking at your arms bilaterally. The skin is generally evenly distributed. Texture is smooth. Temperature bilaterally symmetric and the same both sides. I will be palpating radial pulses. Radial pulses are bilaterally symmetric. I don't notice any lesions. I don't notice any scarring. I don't notice any changes, well, that I can see. But have you noticed any changes?
No.
No. Okay. Had I suspected any insufficiency, I would have checked the brachial pulses, but at this point you did validate that you haven't noticed any changes, so I will not need to check the brachial pulses. I'm going to be checking your legs. I'll check the skin. Same thing, evenly distributed. I'm sorry, do you shave or have you shaven?
Yeah, I shaved.
Have you noticed any changes in hair distribution?
No.
Okay, very good. Now, as you validated again that you didn't notice any changes in your skin, but had the hair been on your legs, then I would say it's evenly distributed and normal. Pigmentation of your legs are even. The hair on the legs are shaved, so there's really coverage on the legs, and dorsal surface of the toes are evenly distributed again. Venous pattern is barely visible. And the size of your legs are bilateral and symmetric in size, okay? I don't notice any swelling. I'm checking pretibial edema at this point. No swelling noted. I don't see any lesions or scarring. And I'm going to check for capillary refill. And bilaterally, capillary refill is normal at less than 3 seconds, and that's normal. I'm going to use this pillow. You can lie back for me if you feel more comfortable. Okay, and I just want to elicit and check for the home inside. I'm going to dorsiflex the foot. Does that cause you any pain? No. No tenderness?
No.
No pain there? No. No pain in this area, in the calf area, right?
No.
No, okay. So that's negative Homan sign, which is normal, okay? Right, at this time I'm going to be checking the pulses. What I'll do is I'll start from your feet and work my way up, okay? Now what I'm checking for at this time, again, this will tell me about the sufficiency of your circulation in your legs. And I'm checking the dorsalis pedis pulses. They are even, bilaterally, strong. Now grade the pulses also a 2+. And I'm checking the tibialis, dorsalis, posterior tibialis pulses. Bilaterally strong. And I'm going to be checking the popliteal pulses. Normally these may or may not be palpable. Strong popliteal pulses. Bilaterally, I do feel them. And if you can please lie back for me, I'm going to be checking the femoral pulses, which we would find in the groin area. Now we'll check this side. Femoral pulses, bilaterally strong. Okay, this concludes our peripheral vascular system assessment. I do want to emphasize nail polish. It's a little tricky. Sometimes we can't see underneath, and we want to have the opportunity to be able to see clearly what's going on, especially with circulation. So keep in mind with the nail polish. And also walking is a very good exercise. I just wanted to let you know that if you have an opportunity, try to get an opportunity to do 1 to 2 times a week to exercise. Walking is a very good option. Do you have any questions for me?
No.
All right, very good. This concludes our physical examination.